On this episode of Newt's World, on Wednesday, January 22nd, Representative Chip Roy released a new report entitled The Case for Healthcare Freedom, A System for a Healthier America. The report is a painstakingly researched 47-page report on America's health crisis and how to address it, presenting ideas on how the Trump administration and congressional Republicans have the opportunity to deliver transformational reform to our healthcare system. The report asserts that healthcare freedom is the simple idea that American patients and doctors must be empowered to decide and provide healthcare, not insurance companies and corporate or government bureaucrats. We should have the freedom and incentives to make informed, healthy choices about the food we eat, the medicine we take, and we should be able to insure ourselves against financial risk of a health event in a robust competitive market. Here to discuss his plan, which I am deeply intrigued with, to make America healthy again, I'm really pleased to welcome my guest, Representative Chip Roy. He is currently serving his third term in Congress, representing the great state of Texas's 21st Congressional District, which includes South Austin, North San Antonio, and the Texas Hill Country. Chip, welcome and thank you for joining me on Newt's World.
Mr. Speaker, great to be on the show. Really appreciate all you do and all you've done since being in public service, and you're still intimately involved with what we're doing, and I appreciate it.
Listen, you talk about healthcare freedom in your newest report. Could you define what you believe that means for the average American family?
Yeah, and you just read the description that we put in the report, but I put it in basic terms. And I say this as a cancer survivor. 13 years ago, I finished my last chemo treatment, I think 13 years ago last week, when I was working for our mutual friend, Governor Rick Perry. We had just finished his presidential campaign, and frankly, I was helping on yours for the remaining pieces of it. When I came through that, and I was blessed to be able to go to MD Anderson, and as Obamacare has gotten entrenched, which, by the way, it's not just Obamacare, right? It's decades of having created this monstrosity where you no longer have anything resembling healthcare that is free market oriented. So my simple notion is empower patients and doctors with expanded health savings accounts, access to what we call direct primary care, which means you've got access to a doctor directly, you have their cell phone number, you actually have care, and then decouple that from the requirements that we currently have on insurance, and to make sure that we can have people be able to go get real insurance in the market. And once you do that, you've now changed the whole dynamic, and you've freed it up so that people can be able to go out and get the care of their choice. You've said it very well. We need to get back to care, because we're confusing healthcare with care, and it's not the same thing. And I think what we can do, if we are bold and transformative, would not just help individual families and individuals be able to go get care from doctors of their choice rather than insurance companies and bureaucrats, but it would actually drive down the prices, and it would actually help our deficit and debt pile up with the federal government. We have $5 trillion that we're spending annually on healthcare. You know that. But yet somehow we spend 3 times more per capita than Italy, but we have a 5-year shorter lifespan than they do. The average family and their employer pays $25,000 a year for their, quote, health insurance. But that insurance is so disconnected from care, right? They're not able to go get care. And now you've got families that are getting subsidized up to $600,000 in income because of the way we've so distorted the system. And all of this has a lot of corporate crony components in it with respect to how much the corporations are spending. $750 million spent by big healthcare in lobbying the government, which is more than defense contractors.
What you're tackling is really important. Now, a key part of what you would do, if I understand it, is to use a substantially bigger tax advantage health savings account so people could shop around in a transparent market. For me and my family, how would that work?
Well, so for right now, for the average family, you go spend out of your pocket, call it $800, and your employer pays $1,600, and that money goes to Aetna or Blue Cross or whatever, and then they are giving you so-called insurance. But for that, you have a really high deductible, a really high copay, and so all of that adds up to something like $25,000 a year, but yet you're still spending a lot out of pocket, but all of that is deductible, tax deductible for your corporations. So what we want to do is take what is an existing product that I think something like 60 million Americans use with health savings accounts, but we want to make them robust and central to the entire health care operation. So what that means is you would get the tax advantage as the individual when your employer is funding your health savings accounts. They would get the tax break, but it would be equal. So if I'm self-employed and I put money in the account, it's a tax break. If the employer chooses to give you the money into the health savings account rather than giving it directly to Aetna, they get the tax break for that, which means you're getting the benefit. You've got the dollars. Once you've got that money sitting there in a health savings account and you can go shop, now you're on a level playing field. Right now, I need to get my oil changed. There are probably 50 places within 10 miles of here that I can go compete and get my oil changed. But if I call up Aetna and get some representative on the phone or call up Blue Cross and they're in Kansas City and they answer the phone, I say, all right, what doctor can I get? They're going to give me a list of like 3 in a 50-mile radius that are in network. I have very few choices. They're in a corporate environment, and you don't have the ability to get their cell phone, work with them directly. You have to go through some big website. This allows us to go out and go shop for both insurance, but also importantly, direct primary care and other models like health sharing ministries. All of those things would be allowed to be expenses for you, and you'd have control of the care. Now, why does that matter? Last point. If you look at, for example, a knee replacement, and you know this well, right? You go to the hospital and you need your knee replaced. And you say, well, how much is that going to be? And they say, well, that's going to be $48,000, but your insurance will pay for X and you're going to pay, $15,000 or $20,000. But it's $50,000. If you go to the Surgery Center of Oklahoma, they've got a robust model and they put all their prices up and it's direct care and they just give you the price and it's $14,500. Now, why is there that difference in price? Because we've propped up and funded this robust system where all of the insurance companies and big hospitals and so forth are making the prices go up, and because we've been intertwined Medicare and Medicaid into all that. If you want price transparency, give the individuals the money and give them the same tax breaks that corporations get so they've got it and they can use it.
To take your example, you're going to have an amazing number of hospitals fight you. I've been an advocate for years of having a transparent pricing system. And it's amazing, virtually every element of the health system is against it. They don't want us to know what we're paying for.
And that's because that would actually break the system down. Look, this is part our fault. I represent the Hill Country. Lyndon Johnson's ranch is in that district. This goes back, and if you go look at 1964, 1965, with the expansion of Medicare and Medicaid, everything that you see with the widening price increases, if you go look at the charts that show private healthcare funding versus government, in 1964 or 5, it was basically 95% private and 5% public. And those lines started converging. And then in the 80s and then into the 90s, they started converging more. And then through Obamacare, they've converged almost down to equal. And then now they are 50%. It's basically 50-50. And what is private is highly regulated. Meanwhile, you've had a, 1,000% increase in administrators in my lifetime. But meanwhile, doctors have stayed the same. That's what you see. Paperwork, bureaucracy, administration. You don't see doctors and patients where they've got full control over what they're doing.
And we've noticed, for example, that the tension for the doctors leads to a dramatically higher suicide rate for doctors because they're so conflicted. They go to medical school so they can focus on you, and then they end up in practice and are told to focus on the insurance company or the government bureaucrat.
Well, that's exactly right. And most doctors went to medical schools because they just want to provide care. They don't want to have to go fill out forms and check boxes, which is what they spend half their time doing. And again, we've created that complex maze. And it's not just Obamacare. It's not just the sort of recent policies. This is a compilation of policies that have added up to this complex system. But meanwhile, insurance companies, and I'm not trying to vilify insurance companies, but they're making a significant amount of profit with the government giving them regulatory constraints on any competition. And so when you do try to have competition, you meet resistance. So for example, health sharing ministries, which are religious based, but there are some non-denominational and there's some secular versions of these too, where they allow you to share healthcare prices. So you can actually help each other out. You put money in a pool, somebody, needs a certain procedure. They don't have $1,000, they get it covered. And it's worked quite well to be an affordable way for people to afford predictable, but yet shocking events to their fiscal well-being. But yet we get told state by state, state capital by state capital, oh no, you can't do that. That's insurance and we need to regulate you. Like anything you do to try to break into that so that people can be people and help each other out, either through charity or by allowing actual risk management through true insurance to work, those get beat down. That's what we have to free up. Healthcare freedom is freeing that stuff up. Allow me to go to the doctor of my choice. Allow me to use tax-free capital. Allow me to go to health sharing ministries to defray costs. Allow me to get an insurance product that will roll the dice based on my risk portfolio. And yes, we can still have government backstops, but make those as local and make those as tightly focused as possible in local and state jurisdictions.
Do you think there has to be federal preemption of the state regulatory system?
I think if you can unwind the federal constraints, which are also a problem, but also I think we do have to break down some of the state, at least as long as federal dollars are involved, which they're all going to be in our lifetimes. You're going to have to break down some of the state regulatory mechanisms that frankly are propping up some of the problems we have where we end up with massively consolidated hospitals. I saw a report I'm sure you've seen in like Pittsburgh and some other parts of the country where there's like no choice, right? All of the consolidation has gone into like some one big corporate entity, and antitrust is complex, and we don't need to get into an antitrust lecture here, but we don't have competition. That's the bottom line. We don't. And some of the state regulatory structures are part of that problem. So yes, we need to reduce federal and state barriers to competition and choice.
Let me switch totally to actual health, because you note in your report that 40% of Americans are considered obese compared to just 10% in 1950, and that there are health conditions like cancer rates which are both rising but also occurring earlier and earlier. What do you think has happened to the actual health of the American people?
When you go back to when I first came to Congress in 2019, I introduced the Healthcare Freedom Act, which was built around the model we just described. That was a product of my years of experience, both as a chief of staff to Senator Cruz, working for John Cornyn, and as a cancer survivor, working for Rick Perry, and at the Texas Public Policy Foundation, where we studied these things with our mutual friend Brooke Rollins and others. And so fast forward, and I've had a lot of work involved on that piece of this. In the last 2 years, I've turned my focus in addition, not instead of, but in addition to the front end. Like, why are we unhealthy? Why are we having to go seek so much health care? And frankly, it's just simple things. Like when you eat real, good, natural foods and you don't eat processed foods, when you eat properly, you eat meats and so forth instead of high carbs and everything else, you frankly feel better and you're healthier. And it's just pretty obvious. And I think people are seeing that. And RFK Jr., Callie Means, some of these other folks deserve a great deal of credit for having really lifted people's attention on that. Now, I will also note, COVID, I think, was the great shift. And I think it was the great shift in other areas in terms of the tyranny of government and the use and the power of government, but also how we view vaccines and how we view the power of government in telling us what we should or should not put in our body and whether or not we're getting the real facts. Just provide the information for the American people. True, actual data and information, true science. Make the NIH and CDC, don't make them revolving doors for big pharma. Let's have actual scientists saying, here's the data. Here's the truth. Here's what we know about COVID. Here's what we know about the vaccines. You're free to go choose. You're free to decide. Because, Newt, my dad had polio. You don't think for a minute I'm not truly happy and that we're blessed that my children could get a polio vaccine or I could get a polio vaccine? My dad is still alive, but he can barely walk, having survived bulbar and spinal polio. We're blessed to have those things. But at the same time, we should look at the science of all of them, including the polio vaccine, so we know the truth. Because I think something is happening where we're over-medicated, likely over-vaccinated. We're certainly eating bad foods. And I don't want a big government regulatory complex telling me what to eat. If I want to go eat a Frito pie, I ought to know what I'm eating, and we ought to inform people. And yes, we probably should still ban some substances that are in all of our foods that are killing people, because we're spending trillions on the back end because we're allowing it to happen.
Part of why the so-called Mediterranean diet works, they don't have processed food. The tomatoes taste differently because, in fact, they're fresh. The whole process is just different and leads to very different health outcomes.
And you feel better. There's a restaurant on Capitol Hill. I'm not going to give its name out because I don't want to have a whole bunch of people go inundate her, but it's a great restaurant. And she flies all of the ingredients in from Italy and they make it all right there. And when I eat there, I feel great. And you can eat bread, but it's real food. It's real ingredients and you feel fantastic. It's not always cheaper, but that's partly because we don't have a market on every corner with that stuff because our markets are filled with Cheetos and processed food.
How do you incentivize healthy habits?
Well, I think that's actually the hardest thing. The easiest thing for us to do would be to convert our tax policy and free up direct primary care and free up insurance. Like we have the power to do that like this if we have the willpower to do it. And I think we should. On the healthy habits side, I think you've got to have a little bit more of a connection. And I do think there is a connection here. If you have health savings accounts and you know how you can use them and you can go pay for a doctor and get care and get good mental health care and other things, I think that you will be incentivized to be able to get exercise, to eat the right diet and so forth, because you're controlling those dollars and how they're connected to your health. But the second and the probably most important thing we can do is put out real good science-based information. You know, when we grew up as Newt, me a little bit behind you, not too far, we had the food pyramids and we had the 4 food groups and we had these things. They were pounded into our head. Some of that was good. Some of that was bad. Basically, I took away from that a well-rounded diet and so forth. But, you know, I grew up on a farm. We live on 10 acres. We try to grow stuff locally, buy locally. And my kids are healthier for it. And they're reading Callie's books and all that stuff. But we got to get that more into the bloodstream, so to speak, pun intended, of the American people in the schools and through the USDA, and hopefully work with Brooke and everybody over there to do that. There needs to be synergies there to make that happen.
That gets back to the whole science-based, because all too often some of those charts get designed by lobbyists working for specific big groups. One of the things that I was really surprised by, I wrote a book many years ago called Saving Lives and Saving Money, with that specific title to make the case that saving lives is moral, and then you get to save money after you save lives. But I was surprised at how actively hostile the healthcare system is to innovation, how many interest groups will combine to kill breakthroughs that will be better for patients, less expensive. What's your take on all that? How do we break through that sort of iron wall?
Not to beat a drum too much, I am going to do this repeatedly. We've got to empower individuals, empower doctors. They have to serve as the hub and spoke of the system. And we've got to make insurance companies and, frankly, pharmaceutical companies and hospitals more trivial, right? They need to be sort of on the side of the system where the patients and doctors are at the center of the system. So we put this report out last week. Well, it's not news in town that this is where my leanings are. I've had my bill out for 5-6 years. But let me tell you, we put the report out with all of the data and all of the charts and all of the stuff. Man, there was a rumbling down at K Street. I got a lot of friends that are all down there. You do too, right? And you start hearing, oh, you sure caught some attention down there with some of the pharma companies and some of the big insurance companies. And I said, well, good. Newt, when I got through cancer, there was a trial drug called brentuximab, which was created, and I was on the trial at MD Anderson. It's a great drug. It's now the standard of care for Hodgkin's lymphoma. I had stage 3. Great. I'm glad. And I said in a hearing once, I hope that the company that made that is rolling in money, because I actually do. I want the market to work and incentivize people to be, as you just said, innovative. But what I don't want is for the government to be then saying you must take these drugs or these are the only way to do it, and to clamp down through what I would call pejoratively or just in recognition of the truth, crony capitalism, where the government regulates, the government tells you what you can have and do, it constrains competition, it constrains choice, and then you've got the system that we have. The only way to sort of fix this is through empower, and this is true in all things, right? Milton Friedman would be sitting here smiling, right? Empowering me, empowering you, empowering our wives, our families, our children, and empower doctors. Right now, we have too many constraints on doctors and too many constraints on us for choice. Free that up, and then we can make this work.
I want to drive this home for our listeners. You cannot fix the federal budget unless you get a healthier country. You can't just approach healthcare as a financial problem because it's people's lives. But when you realize that this is your data, but I want you to comment in a second. In 2023, healthcare spending in America reached $4.9 trillion, 17.6% of the gross domestic product. Costs are growing about 1% faster than the annual GDP. It's such a big cost that a third of all the money the federal government receives is spent on healthcare. It's impossible to talk about getting to a balanced budget until we deal with health.
That is 100% correct. We've got 13% of our total budget, okay, which will be close to $7 trillion this next year. Okay, so everybody put that in perspective. Close to $7 trillion in 25. And about 13% of that is Medicare. Another, I don't know what the percent is of Medicaid, but a sizable chunk, I think it's something like, another maybe 10, 12, 13%. So you got a quarter of that. Then you add veterans in there. Now you're ending up pushing up to where you're talking about with the third. And we just massively increased veteran spending in the wake of the burn pits. Now, we should have taken care of our veterans with burn pits. But my point is, to your point, literally something like 2 trillion, 2.5, 3 trillion of what we're putting out every year and 7 trillion is all connected to healthcare. And so if we want to get deficits down, if we want to stop inflation, if we want to reclaim the strength of the American dollar and economy, you have to drive down the prices in our healthcare system, which again has to go back through empowering the individual. By the way, we can do that in Medicaid and Medicare. You well know, right, what we did in Medicare Advantage, which has some positives and some weaknesses, but it inserted some competition into the Medicare matrix. That caused some serious price movement in the right direction, moving prices down. There are some hiccups with that because it's in this complexity of Medicare, but we've got to provide more competition in there. For example, Medicaid. You could have in that robust health savings account model that I put out there to start with, not just employers putting it in there, but the government Medicaid subsidies could go into that same framework so that an individual can then go out and go to direct primary care. I went to a direct primary care facility in East Austin a couple of years back, and there were these guys that were starting it over there because they were musicians and all of these artists in Austin who didn't have health care. And they said, look, we're just going to do a DPC model, direct primary care, without the insurance company, and people can come in there and get care. And it was very well received. I need to go follow up and see how they're doing because they have so many barriers. But to your point with the budget, we can get serious prices driving down if we will change the system and make it work so we can get savings in Medicare and Medicaid. You don't have to change the benefits with respect to Medicare with our retirees. But what we need to do is stretch what they get with those dollars, right? If we do that, now we can get over the next 10 years in the budget, we can get all of that down to a place where we can afford it. Medicaid, Medicare, and also with veterans health care as well. And by the way, I have some veterans direct primary care models and other things to increase competition, which I think are adding some value in it as well.
In your model, if you have this dramatically bigger health savings account grant, is that taxable income to the employee or is it outside the tax system?
That would be tax-free to the individual. So the corporation would take their dollars, they would put it into the health savings account. That health savings account would be tax advantaged to the employer for putting it into your account and would not be taxed to you. And the growth on that account would not be taxed. And if you transferred that money to your child, that transfer wouldn't be taxed. Like you would be free to help your family members as well.
In terms of helping my grandson, for example, or my daughter, does that have to be helped towards a health problem?
Yes, the way we designed it, of course, you and I both know we could structure it however we want to, but yes, we would put it in there so that you could give that to your grandson or your child or whatever. Frankly, the way I originally drafted it, I said you should be able to do it for anybody. If the veteran down the street needs help and you have tax advantaged health dollars sitting here and you've got 100,000 saved up, and that veteran needs help and you want to take 20,000 and give to that veteran, you ought to be able to slide it over into their account for health benefits as a contribution and then deduct that as a charitable giving contribution direct to a person on your street.
I suspect that would really work with people who are involved in the various sharing ministries you talked about earlier.
That's right. And that would be hugely beneficial for them so that people can move money around and be able to help individuals out. And because like most things that occur, the reason it's so hard to get healthcare reform is because nobody focuses on healthcare prices until it's right in front of them. And then when it's right in front of them, they go, oh my gosh, well, I've been paying for insurance. Isn't it all covered? And then they go look at their insurance policy and they go, well, I've been paying $1,000 a month and my employer's been paying $2,000 a month, but you still want me to pay $26,000 in order to get this service because, my son broke his leg and got in a car accident. And then people go, what the hell? But that's what we've done. That's not the way it used to be. And by the way, why are most hospitals, or at least they used to be, Saint fill in the blank? It's because we had a charitable hospital system where churches got together and said, well, we want to help the poor. Well, great. Well, let's create this because it's part of our charitable effort. We have lost civil society and civil virtue, another podcast for another day, because we've corporatized and governmentized everything instead of it being community and civil society and charitable giving based.
Well, listen, I think the combination of the Trump revolution, of Robert Kennedy Jr.'s commitment to making America healthy again, and the budget crisis, I have a hunch much more of your bill is going to become law this year than anybody would have thought possible 6 months ago.
Well, Newt, I hope so. And look, I think this is the area where we could truly be transformative and visionary. And a lot of people are just writing off Bobby Kennedy as just being a reflexive big government liberal on some of these programs. And I understand. I get it. But I think they're missing the truth. I think they're missing the revolution that's occurring. I think they're missing what's happening. People's eyes have been opened. They want freedom. They want control. They're tired of just being told the status quo is what they have to accept. And that includes what they put in their body in both food and medicine. And it includes the ability to have power to go to the doctor of their choice and not have to sit in line at something of the equivalent of the quality of your post office to go get health care through the insurance. They don't want that. And so I think the opportunity is very big right now.
I'm going to ask you back in a couple months because I do believe you're going to be part of a genuine revolution that leads us to a healthier country, a dramatically less expensive health system, a more health-focused system, and in that process, we'll be taking giant steps back towards a balanced budget. So you're providing real leadership. Those years you spent working with people like Rick Perry and Brooke Rollins and others, you clearly came out of that as a very innovative thinker and somebody who gets it. And I'm just delighted you could spend time with us.
Always happy to do it. Thanks for always being available to all of us and providing your wisdom and experience. And let's talk soon about this and spending and everything more. God bless.
Thank you to my guest, Representative Chip Roy. You can get a link to his new report, The Case for Healthcare Freedom, on our show page at newtsworld.com. Newt's World is produced by Gingrich 360 and iHeartMedia. Our executive producer is Garnsey Sloan. Our researcher is Rachel Peterson. The artwork for the show was created by Steve Penley. Special thanks to the team at Gingrich 360. If you've been enjoying Newt's World, I hope you'll go to Apple Podcast and both rate us with 5 stars and give us a review so others can learn what it's all about. Right now, listeners of Newt's World can sign up for my 3 free weekly columns at gingrich360.com/newsletter. I'm Newt Gingrich. This is Newt's World.